You're live.
And welcome to Norwich, a 111 call centre run by IC24, who are a private company who are contracted by the NHS to deal with calls from patients who might be ill for a variety of reasons, want some advice, want some direction as to where they got to go. I'll just have you a quick look around here. We're not going to get too close to people who are taking calls, partly, of course, for reasons of confidentiality, and we don't want to have my big, booming, loud voice getting in the way of their very important calls. But you can see that although there are 7 or 8 people there, this is not a particularly busy time for the call centre. The busiest times are, of course, in the evenings and at weekends when people feel that they haven't got necessarily the access to be able to go to their GP centre. Let's talk to Chris, who's one of the call centre workers here. He's on a break at the moment, but up until literally about 2 minutes ago, he was taking calls. So, Chris, give us an idea of the last call that you had. What was that about?
Okay, the last call I had was for a gentleman who'd been having some abdominal pains and also been having some back pains that had been going on for a little while.
And what did you end up doing with it?
Ended up eventually getting to pass him over to one of my clinical colleagues who will be calling him back and just giving him some additional help and advice.
I appreciate everyone's different, but a lot of people must be a bit panicky, a bit frustrated perhaps that they're not talking to someone who's medically trained, because you're just following the systems to be able to sort of pass on.
Yeah, I'd say most of the time they are sort of very appreciative, very thankful for all the help you do. Let's say there is those occasional people that aren't very thankful, that do get a little bit annoyed when we're asking questions to them.
And if you're saying you really don't need to go to A&E, are they arguing with you some of the time?
Sometimes, but 9 times out of 10 they're saying, yeah, okay, thank you for the advice, and accepting the advice that we've given them.
Are there really difficult calls to deal with? What's one of the more difficult ones or dramatic ones that you've had to deal with?
I've had all sorts. So I've had sort of very sort of minor stuff to sort of the full-blown cardiac arrest. So we do get everything here, unfortunately.
And do people, they've called 111, you immediately say, really, you need 999 rather than 111?
So we help them all out. If they directly say, oh, I would like an ambulance, then we do, well, so I tend to advise that, yes, why don't you dial 999 instead of 111, because that was the quickest way to get help for them. So because we're only in the advice line, so we advise them on what to do.
Police and ambulance will report all sorts of, not necessarily crank calls or hoax calls, but people who are time wasters. Do you get a few of those as well?
Sometimes, not all the time. So it depends. Sometimes, some days we don't get any. On the odd occasion, we may get 1 or 2.
All right, Chris, thanks very much indeed for talking to us. Let's give you another sort of idea of where we are, because it is just a call centre, and we're on an industrial estate on the outskirts of Norwich. So this is where we are at the moment, and you can take a look outside to sort of see the surroundings that we are. This is a call centre which, even if you dial 911, even though it's a national number, if you're in Norfolk, it'll be routed through to you. And if you want to know how they are performing at the moment, there is a constantly updating board where you can get that kind of information. So if we take a look up here, you'll see that this is the Norfolk Centre here. They've had 180 calls since midnight. 95.4 is a percentage. That's 95% of calls have been answered within 60 seconds. The other numbers above them are call centres dealing with Essex, Great Yarmouth, North Essex as well. So you can see they're all in the high 90s, whereas the national average for dealing with it, according to the figures out today, is 88%. So they're dealing with things reasonably well. Let's talk, and by the way, we will, of course, and try to answer some of your questions about how the service operates. We're not here to deal with calls such as what's this rash that I've got on my body at the moment, or any medical inquiries, but we will deal with how the system works. And to give us a bit more of an indication of that, this is Helen L, founder, who is a former GP, who's clinical director here now, and just explain to us what's a good day for the centre when you've what's a success?
Well, every day is a success here at 111. I mean, just helping patients is what we aim to do, and is what we do on a daily basis. So, it's always nice to feel that we've done it to target, which we do most of the time, and it's just nice to help that patients get to the right place for the right treatment. So.
But everyone thinks the NHS is in crisis at the moment. Do you think it's in crisis?
I think it's difficult at the moment, definitely, but that's across the whole system. That's from, community services, general practice, A&E, 111 services. Everybody's really struggling, and a lot of that's due to the fact that patients are sick, and it's that time of year, and we have an elderly population. But as I said before, what we need to try and do is make sure that those that don't need the acute services, that don't need the ambulances and don't need the hospitals, are then aware of where they can have treatment that's appropriate for them.
Just trying to respond to some of the messages and questions that we've had. Someone simply said, when do you know to call 111 over 999? What's a good example of that?
I mean, if you believe that you have a life-threatening condition, then you should call 999. And they have a similar assessment tool as to we have within Pathways, and obviously you'll be asked a series of questions, and they will determine whether or not you do need that ambulance. If you don't believe it to be a life-threatening condition, for whatever reason, if you need medical help or just some advice, or even if you have a question, then you call 111.
How can people who are taking the calls, who have no medical training themselves, and you have because you're GP trained, but these people are just not straight off the streets, they have training, I grant you, but they're not clinicians. So how do they know when's the right time to refer somebody on to accident and emergency?
So the way that Pathways works is that there is a series of questions and pretty much determined on the answers that the patients give you and the condition that the patient has. And those pathways are very intricately woven into the framework, and they will take you through what needs to happen to that patient. At the beginning of each assessment, there are the life-threatening answers that or questions that we have. So are you bleeding very heavily? Can you breathe? And if the answer to any of them is yes, then they're quickly diverted through to the ambulance service. If you get through that system and you then come through to the following pathways, the call advisors are very well trained in the questions that they ask, and that will bring you through to what we call as a disposition, which is the where do you need to go next? Do you need further advice? Can we offer you the advice over the phone, or do you need to go and physically see somebody? And then it's a question of how quickly do you need to see that person, and where do you need to see that person?
Let me ask you a sceptical question from Kate Willis.
Okay.
111 just doesn't work, does it? A huge percentage just ends up being sent to the GP, surgery, or to accident and emergency. That's a criticism that you're too cautious. You'll send people who don't really need to be there.
111 does work exceedingly well. And we don't send everybody to A&E, and we don't send everybody to the ambulance service. We do send people back to their general practice quite appropriately. Today, it's a nice day. There are patients still calling 111 for many reasons, but it may be completely appropriate for them to go back to their GP and have further assessment or referrals from their GP. If we can deal with that call from here, we will, and we don't necessarily need to refer people on. But if we do refer people on, then it's appropriate and they need to be seen in another face-to-face setting.
Give us an idea of the percentages of how it breaks down, how many people are sent on to the hospitals.
So over the Christmas period, we sent 7% of our patients to A&E, which is well below national average, and we sent approximately 10% of our patients through to the ambulance service, which again is well below national average. And we do work really hard on that to try and ensure that we're not impacting on other systems and other trusts, and that's one of the reasons why we're trying to put senior clinicians in to assess groups of patients that do need further clinical assessment.
And in terms of the number of calls that you get on a daily basis, and how was Christmas, for example? Yeah,
so Christmas was really busy, and we took large number of calls over and above what we have done over other times of the year, but we expect that and we plan for that, and we try to ensure that we answer all of those calls and direct those patients through to the right service.
Here's an interesting question. Someone who used 111 on Sunday said got very helpful advice and was seen by an out-of-hours doctor, then advised to go on to see a GP. Can't get an appointment until the 31st of January. Is 111 just for referrals?
No, 111's not just for referrals, but that patient obviously required something that couldn't be offered in the out-of-hours service. The out-of-hours service is very much an acute care setting, so if you have a problem that's an acute problem, so it's happened over the last 24, 48 hours, then it's a very good service being able to deal with that. If you have a slightly longer-term condition or need a referral back, say, through for a scan to the hospital, then at the present that has to come through your GP. Now, as a system, working within the NHS in Norfolk, that is something that we are looking at, and we are well aware that if access to onward referrals is more available, then we might not have to refer everything back to general practice, because we are very aware, as I am as a GP, that general practice is also overstretched, and we need to do what we can as a system, all working together to try and reduce that capacity, and that's something that we are definitely looking at.
We all know that 999, police, ambulance, they sometimes get calls about subjects which are entirely inappropriate. Do you get strange calls? Do you get inappropriate calls?
All the time. But, the patient's ringing for a reason. It may well be that they don't know who to call, or they're actually seeking advice in the way that that's the way that they feel they need to seek advice. So each call is taken seriously, each call is assessed and triaged, and we do try and provide appropriate advice, even if it's not within our expertise.
Sharon asks, can 111 help with mental health problems?
Absolutely. 111 is we're all trained to deal with mental health problems. We have mental health pathways, and we have access to mental health clinicians, both in hours and out of hours. So we can refer to crisis team, we can speak to them for advice and support, and we can even see patients. We see patients as GPs in the out of hours setting with mental health problems all the time, and we try and provide them with the best advice that we can.
Thanks very much indeed for talking to us, Helen. Let's have a quick wander around just before we say goodbye to you and see that the calls are still coming in over here. One of the calls that I was listening to earlier on today, or listening to our end of the call here, was from someone, a parent, who was very concerned that their 5-month-old baby had rolled off the sofa, banged their head on the floor, didn't know quite what to do about it, and as all parents know, you want the best for your child, you don't want to take any chances. So she was ringing to find out whether or not it was appropriate to go to accident and emergency, and in this particular case she was told yes, out of all sense of caution, then you probably should get it checked out. But they had to go through lots of questions and answers before they had that point. So I hope we've been able to answer some of your questions about what goes on at a 111 call centre, especially this one here in Norwich.